Hi. Hi. Take a seat, make yourself comfortable. My name's Dr. Sarah. Pleased to meet you. Before we start today, I'd just like to confirm your details. If you could just tell me your name, please. That's fine. And your date of birth. Right. Your address. Okay, that's fine. And current contact telephone number. Alright. That's perfect. Okay, and what brings you here today? Yes, the cranial nerve exam. Okay. Have you had one of those before? Okay. Well, it's just a simple test to check the cranial nerves which supply the face and head. Okay, they connect to the brain and are involved in vision, muscle movement, sensory and hearing things. Okay, good. So I'll run through different little tests to test each cranial nerve as we go through. Okay. Alright, so are you feeling well at the moment? Have you been well for a while? Good. And you've got no real problems, okay, that have made you want to have this exam. It's just something you like to have done now and again. Okay, that's fine. I'm happy with that. Okay, so are you sitting comfortably? Good, good. Well, before we start the actual cranial nerve exam, I just always like to check the temperature of my patients just to make sure that they are okay. Okay, so that there's no underlying infections that can affect any results. Okay, so I'm just going to pop this by your ear, and it won't go into your ear, but it will just take your temperature. You'll hear some beeping, okay? So you should just keep yourself very still. All right. It doesn't take long. There we go. You're absolutely fine. 37. Perfect. So that's good. So for the first part of the cranial nerve exam, I want to check your olfactory nerve. Okay, and this has to do with the function of the sense of smell. Okay, have you had any problems with your sense of smell or taste? No? Okay. Well, firstly, can you just pop your finger over one nostril? Okay, push it in and breathe up. So, okay, and can you do with the other side? So block this nostril and nice breath in for me. Okay, that's fine. And you've got no pain or pressure around the sinus area. Okay. And you've been well, so you've not had a recent cold. That all sounded very clear anyway. Alright, so to test your sense of smell, I'd like you to just close your eyes, okay, and close one nostril for me, and I'm going to pop something under your nose, and I want you to tell me, this is just a solution, I just want you to tell me what you can smell, okay? Okay, so close your eyes and close one nostril for me. That's great. Okay. So, tell me what you can smell. That's perfect. Okay. That was lemon. And can you block the other nostril instead now? Keep those eyes closed. Okay, lovely. And tell me what you can smell now. Okay. Yep, it's fine. was cinnamon. That's perfect. And the next one, just leave both nostrils clear now. And I'd like you to tell me what you can smell now. Coffee. That's perfect, well done. So you have no problems there with the olfactory nerve. Okay, that's all good. Now, the next part of the exam, I'm going to be checking the eyes, okay? So there'll be a few things that I'll be doing. I'll be getting you to follow a light. I'll be looking closely in your eyes, okay? And checking your blind spot and your peripheral vision, and also a little vision test. Okay? Right. Firstly, I'm going to just get you to look straight at my nose, alright? Don't follow the light. Okay, I'm just going to flick the light across there. Just checking your pupillary reaction. Okay, that's really good. And well done. Okay, and again, just keep looking at my nose. Okay. All right. Well done. Okay. There's no problem with that. Okay, that particular part. Okay. So, for this part, if it's okay with you, I'm just going to come in very close, okay, and just have a look at the fundus, the back of the eye, okay, so I can look at the vessels and also the optic disc there, okay, so you're okay for me to come in close. All right, okay, so you'll see this light. Okay, I'm just going to come in close. Could you look up for me and down to the left and to the right? Okay, that's great. You okay there? Super. And again on this side, it's coming close to you. Okay. So let's just have a look. Can you look up for me? Can you look down to the left and to the right? Okay, wonderful. Just give those eyes a little break for a second. Just jot some notes down. Okay. Okay. Right. What colour is this pen? Okay, that's fine. Can you cover your left eye and look at that again? Okay, and now can you take your hand off your left eye and cover your right eye? Okay, Does the red look the same through each eye? Perfect. Okay, so now I'm just going to check your blind spot. So can you pop your hand over your left eye for me? That's fabulous. Okay, and I want you to tell me when you can't see the pen anymore and then when it reappears. Okay, so you can see that there. Okay, I'm just going to move it up and down and from side to side. Okay, so tell me when you can no longer see it and when it's back into view. No longer see it and when it's back into view. Okay, that's great. And do the same but from side to side. Okay, fabulous. Now can you cover your right eye for me? And we'll do the same again. Tell me when the pen disappears and then when it comes back into view. You can see that okay. Good. Okay. Okay. You're doing great there. Okay. And from side to side, tell me when you can no longer see it and then when it comes back. Brilliant. Okay. Perfect. No problem there. Okay. I'd just like you to look straight ahead now, alright? And tell me when you can see my finger. Okay, can you see it wiggling? Okay, so can you see it? Tell me when you can't see it. Brilliant. Okay, tell me when you can see it. Okay, and again. Okay, this is making you giggle. Okay, and again. Okay, tell me when you can see it. And it's gone. Okay, and can you see my finger? Yeah. Okay, and again on your left side. Okay, that's wonderful. Okay, and can you just quickly follow my finger? Okay, so don't focus on my nose this time, just follow the finger. Just check how those ocular muscles are working. Okay. Okay, and can you look up for me? Okay, and down, and look to your left, and to your right. Okay, fabulous. Okay. This time, I'd like you to follow my light, okay? So again, don't focus on my nose. Actually, follow the light. Don't move your head. Keep your head perfectly still and just follow. I'll be moving up, down and diagonally. Okay, starting from there, okay, to your right, to your left, okay. Okay. Okay, keep following the light for me. That's perfect. Thank you. Okay, so now I'd just like you to close your eyes, and I'm going to hold your eyes closed, and I want you to try and open them. Okay, so close your eyes for me. Okay, there we go. Try and open them now. Okay. Okay, I'm now going to try and force your eyelids open, but don't let me open them. Okay. Fabulous. That's perfect. Okay, so in my pocket I have a little Snellen chart, and I'd just like you to read a few things off here. Okay, so can you read the top letter there? Yeah. Okay, and can you read this line here? Yeah. Can you read that there? Okay. Now can you cover your left eye for me? And can you do the same? Can you read that there for me? Okay. Can you read that line there for me? And can you try there? Okay. Okay, so now can you cover your right eye for me instead? Perfect. And we'll try that again. Can you read that line there for me? And that line there? Perfect. And that line there? Fabulous. So you've passed that part with flying colours. Okay. Now I just want to check a few little bits of your facial nerve. Okay, so can you give me a big frown? Okay, that's good. Can you give me a big smile? Fabulous. Okay. Can you puff out your cheeks for me? And again. Okay, and now puff them out and don't let me push them in. Okay, that's perfect. Can you push out one side? Okay, and don't let me push that in. Okay, and can you push out this side? And don't let me push that in. That's great. Another frown for me. Okay, and raise your eyebrows really high. Okay, that's fine. Okay. Alright. So I'm just going to pop my hands either side of your jaw, and I just want you to open and close the jaw for me. Okay, so open wide, close, and again. Okay, that's fine. Okay, so open nice and wide your mouth. Okay, wiggle your jaw from side to side. Okay, and while we've got your mouth open there, just a little bit wider and say ah for me. There we go. Okay, can you pop your tongue to the roof of your mouth? Okay, and to the bottom of your mouth. Lovely. And can you move to the left and to the right? Okay, stick your tongue out for me. Give it a wiggle. Okay, alright, that's fine. Okay. Now, have you had any problems with eating or drinking at all? When you swallow your food, everything seems to be going down fine. That's good. Nothing sticking, nothing feeling too dry. Good. Okay, so I'd just like you to take a little sip of this water and swallow it for me. And let me just watch that swallow reflex there. Okay, there we go. Doesn't have to be a huge sip, but and swallow for me. That's great. Well done. Sure, if you're thirsty, you can have some more. There we go. All right. There we go. So let me just make some notes on that. Okay, so are you feeling all right at the moment? Good, okay. So the next part of the exam, I'm going to be checking the trigeminal nerves and the sensory parts of your face, okay, to see how you can feel things on your forehead, jawline, cheeks. Okay, great. Okay, now for this part, I'm going to use a little cotton wool ball, okay, and I'm just going to gently touch and brush parts of your face, and I'd like you to tell me if you can feel it okay. Alright, so just close your eyes for me 1 second. Can you feel it? Yep. Can you feel that? Okay. And can you feel that? And that? Okay. So I'm just going to brush. Can you feel that? Alright. And can you feel this? Can you feel that? Okay, can you feel that? Can you feel this? Okay, this. Alright, and okay, there. And just going to brush the top of one of your arms. Which arm am I brushing? Okay, that's perfect. Now, could you tell me, did the sensation feel the same on both sides, or could you feel it more on one side or the other? Perfect. Okay, so now we've done gentle touch. I'm now going to see how your sensation of sharpness, okay, is doing. This isn't super sharp, okay, it looks quite scary, but it's not. Let me just prove that to you. Yeah, okay, but obviously it's not as soft as the cotton wool ball. So again, I'm just going to touch different parts of your face, and I want you to tell me when you can feel it, okay, and then afterwards I'll ask you if you could feel it on one side more than the other. Okay, so there, yeah, can you feel that? And that, and that, okay, that, okay, there. Okay, and I'm just going to dot one of your arms with this. Which arm am I dotting? Yeah, that's perfect. Okay, lovely. Now, could you feel that on one side more than the other, or did it both feel the same? Super. Okay. Full marks for you so far. Okay. Now, there's a couple of tests I'd like to do with this. Don't worry, it doesn't hurt, okay? And this is the tuning fork, which I'm going to be popping onto the centre of your head, okay? And I want you to tell me if you can hear the sound and if it sounds equal on both sides, okay? So, there we go. Pop that up there. Can you hear that? Good. Can you hear it equally on both sides? Good. Okay. And then this one, I'm going to be placing the tuning fork onto the bone just behind your ear. Okay, and I want you to tell me when you can't hear the sound of the tuning fork anymore. And then I'm going to move the tuning fork round to in front of your ear. Yeah, and I want you to tell me if you can hear it again. Okay, all right. Okay, so just behind the ear there. And tell me when you can't hear it anymore. Okay, and going to move it just to the side of your ear. Lovely. Okay, and do the same on your left side. Okay, so I'm going to pop it behind the ear, then in front. Okay, you ready? Good. Okay, so pop that behind your ear. Tell me when you can't hear it anymore. Perfect. And then just going to pop it next to your ear. That's fabulous. Okay. Perfect. Well done. So, what I'd like you to do is just pop your hand over one ear. Okay. And I'm just going to whisper a number in the other ear. I'd like you to tell me what I've whispered. Okay? Alright. 99. Yeah, that's great. And do the same. Can you put your hand over the other ear and I'll whisper. Okay. Perfect. 72. Wonderful. Right, so you're checking out wonderful, and there's just one last little check I'd like to do for the accessory nerve, and I'd just like you to shrug your shoulders for me, like that. Okay, I'll put my hand on your shoulders, and can you try and push up now? Okay, perfect, that's super. Okay, and can you turn your head to your left? Okay, I'm going to pop my hand on your face there. I'm going to try and hold your face. You try and push my hand away. Okay, lovely. And can you turn your head to your right? And again, I'm just going to pop my hand on there and see if you can push your head back against my hand. Okay, that's perfect. Thank you. Okay, right. Well, you'll be pleased to know that you have checked out absolutely perfectly on the cranial nerve exam today. Okay, I found no problems whatsoever. Everything seems to be functioning wonderfully. Okay, of course, you're welcome to come back and have another check in 12 months' time or before if you think you're getting some problems. Okay, but everything's fine and your vision seemed fine, so I don't need to refer you on, okay, to the ophthalmologist because you read the Snellen chart perfectly fine for what we need for this exam anyway. Yeah. All right. Okay, well, that's all for today and enjoy the rest of your day, and no doubt I'll see you at some point in the future for your next cranial nerve exam. Okay, take care now. Oh, hello there, my lovely. Make yourself comfortable. I'll be with you in just a second, okay? Just checking I've got everything I need today. Okay, so I believe that you're having some severe facial pain. Yeah? Okay. So it came on a couple of days ago. You've never had it before. All right. Yeah. Okay. I'll take a look at you here. Obviously, if it's something I can't deal with, we can send you to hospital if it is so severe. Okay, I just need to ask you a few questions. All right, my lovely. Okay. So, can you just tell me where the pain is? Okay, so it's in the face, near the ear, shooting up into your head and eye. Okay. Is it going to your jaw a little bit? Okay. Just on the one side of your head. Okay, so it's on your left here. Alright. Yeah. Okay. Have you got a general headache? Okay. Feeling unwell in any other way? Okay. Tired? Okay. Because you can't sleep, that figures. Okay. Now, how often is this pain occurring? Is it constant or intermittent? Alright, so you're getting these intense bursts of pain which last anywhere from a few seconds to a couple of hours. Right. Okay. Okay, so average they're about sort of up to 30 minutes. Okay, yeah. I'm wondering if you've got something called trigeminal neuralgia. Okay. That comes from a nerve being aggravated, compressed, the trigeminal nerve, which is cranial nerve number 5. Now, a number of things can cause this, okay, but we need to rule other things out as well. So have you been to the dentist? You have, okay. Right, and they said it's not TMJ, it's not that temporomandibular joint. Right, okay. Yeah, and what pain relief are you taking? Okay. Alright then, my lovely. Well, I think I've asked you enough questions there for now, so let me get on and have a little look at you, alright? Okay, I'm just going to pop some gloves on. You've not felt hot or cold or anything, have you? I'll take your temperature anyway, because it's always useful to get a record of that. Okay, right then. So let me just pop this into your ear, okay? Lovely. Okay, right, just going to pop that in there very gently. Okay, and just a couple of beeps there. Okay. Okay, I'm just going to withdraw that now. Okay. That's fine, your temperature's normal, that's a good sign. Okay, so I'd just like to have a little feel around, okay, and tell me if anything hurts when I press, alright? So this is the side that's painful, yeah? Okay. Okay, so just going to gently just press just around the side of your face there, okay? Does that hurt? Okay. Okay. And for comparison, I'll just touch both sides. Okay. Have you got any numbness on this side? Okay, doesn't feel quite right. Okay. Have you had any blurred vision or anything like that? No. That's good. Okay. Right, I'm going to have a little look in your eyes, if I may. This might be a little bit bright for a second. Just look straight ahead for me, my lovely, okay? Okay. Alright. Can you see my finger there, okay? Good. Could you just follow it for me? Okay. And up. And down. That's perfect, okay. And just up. Okay. And up there. Okay. That's alright. Happy with that. Okay. So, I'm going to ask you to do a couple of little movements for me if that's okay. Alright, so can you clench your jaw for me as tight as you can? Okay, I'm just going to feel as you do that. So clench, 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 clench. Okay, relax. And again. Okay. And again. Okay. Can you open your jaw for me? Okay. Can you push my hand down? Okay. Now I'm going to try and push up. Okay, just resist it with the jaw. Okay, that's good. That's good. Okay. Right, I'm just going to have a little feel down your neck now. Okay. Okay, how was that? Alright. That doesn't feel inflamed or anything like that. Okay, now I'm going to pop my fingers here. Just open your jaw for me. Nice and wide, okay. And close. And can you move your jaw from side to side for me? Okay. Any pain there? Okay, on this side, okay. Can't feel any clicking. Alright, you just relax because I know that this pain is giving you some problems. I can tell. Just have a little relax there. I'll just key in a few things here. Okay. I'm just going to do a little test in your eyes. Okay. Just going to roll up this cotton pad, and I'd like you to look to your right, please, and I'm just going to gently touch your left eye just to check your corneal reflex. Okay. Right, and there we go. Okay, now can you look to your left for me, please? Okay. Okay, that's perfect. Alright. Now, I'm going to press different parts of your face, and I just want you to tell me if it feels the same on both sides. Okay? So, there and there. Okay? And okay, just there on your nose. Okay. And up here and there. Feels a little bit different on this side, okay? There and there. Okay. Alright. I'd like you to just relax your jaw slightly. Not wide open, just gently relaxed, okay? So lips slightly parted. Just relax. That's absolutely perfect. Don't worry, this isn't scary. Okay, I'm just going to check a reflex there. So I'm just going to give you a little tap. Just keep that jaw relaxed, okay? Alright then. Okay, here we go. Okay, and again. One more time. Perfect. Okay. What I'm doing here is I'm checking your fifth cranial nerve, which is the trigeminal nerve. I'm just going to get a tongue depressor for a couple of reasons. First one, can you just bite down on this for me? Okay. Okay, I'm just going to try and remove it. That's good. Hard bite there. Okay. Just going to move it slightly to your right. Can you bite there? And just, that's it. Let me remove it. And slightly to your left there. And again, don't let me remove it. Okay, that's fine. Right. Just going to have a look inside your throat. Okay. Shine this light down there a little bit. Okay, nice and wide. Okay, perfect. And can you say R for me? Okay. Alright. Okay. Just relax there. Okay. So I'm going to do some little checks now, which check for your sensation, okay, whether you've got lots of sensation in one part of your face compared to the other, and something that isn't appearing as quite normal. Alright? Okay, so I've got this needle here. Don't worry, it's not going to break your skin. What I'd like to do first is get you to tell me, with your eyes closed, if what you can feel is sharp or dull. Okay? So close your eyes for me. Perfect. Okay, and I'll just be touching your face on either side. Okay. Sharp or dull. Okay. Sharp or dull. 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 Okay. Sharp or dull. Okay. Now what sensation do you feel down your face here? Is it sharp or dull? Okay, and this side, sharp or dull? Okay, right. Now something a little bit different. I've got a cotton pad. Okay, keep your eyes closed for me, and I want you to tell me if the sensation that you feel is soft or sharp. Okay? Okay. Alright. Okay, is this soft or sharp? Okay, soft or sharp? Okay. Soft or sharp? Okay. Soft or sharp? Okay. Soft or sharp? Soft or sharp? Soft or sharp? Okay. That's lovely. Okay. Okay, you just relax there for a moment. There's a few more little checks I want to do. You just take a little rest a minute because I can see that this is painful for you. Okay? Alright. How are you doing there? Good. Okay. Right. So I want to have a little check inside your ears just to make sure that I can't see anything unusual down the ears. Okay? Is that alright? I'll be very, very gentle. Okay. I'll just use this otoscope. Okay. Let's pop the light on there. And I shall very gently insert it into your ear. Tell me if anything hurts, okay? Just pop up your hand. Alright. Okie dokie. So I'm just going to very gently pull up and back on your ear and insert this. Okay, here we go. Okay. Alright, is that okay? Good. Good. Right. Your ear canal seems fine. A little bit of wax, which is normal. Just going to move a little bit to see the eardrum. That looks fine. You can see all the structures behind the eardrum. Okay. That's fine. I'm going to withdraw that now, my lovely. There we go. You alright there? Okay. Right. Same again on this side. I'm just going to pull up and back on the ear and gently insert the otoscope. There we go. Lovely. another clean ear canal. That's wonderful. Looks very, very healthy. Alright. Okay, we'll draw that now. That's all good. So I'm going to have a little press around your face. Okay, just check sinus pressures, make sure there's nothing untoward there. Okay, tell me if anything feels really uncomfortable when I'm pressing there. Okay. Okay. Right. Okay, and at the top. Right, does your nose feel tender at all? No, a little bit sore on this side again. Right, okay. You've had no tearing from your eyes? No, right. Okay. I'm just going to check a couple of extra reflexes now, just in your arms, alright? I don't suspect the problem is radiating to the limbs, but I just want to check a couple of things, okay? So let your left arm go nice and floppy. Let me take the weight of it. I'm just going to give it a couple of taps with the hammer. Alright, okay. Okay, nice and floppy. Wonderful. Just relax there now. Okay. Do the same with this arm. So let your right arm just rest in my hand. Okay. Let me take the weight. All right. Okay. Perfect. Just relax there. Okay. Just like to ask you to close your eyes one more time, and I'm just going to run this cotton pad down both of your arms. Alright, tell me if the sensation feels different on left or right, or are they both the same? Okay? Alright, here we go. Okay. Okay, did that feel the same on both sides? Good, okay. So I'm going to do the same with the sharp sensation now. Okay, so okay, and on your right side, how was that? Same on both sides. Open your eyes now, that's fine, thank you. Okay, right, I'm going to take some blood from you, alright? I want to just do some general full blood count checks, okay? Make sure everything's as it should be. Okay, so do you have a favourite arm for this? This one? Okay. I don't really want to inflict any discomfort on you, but I'll be quick. Okay, I'm just going to pop this tourniquet round your arm. Can you just make a fist for me? Okay, that's perfect. Okay. Alright. A little wipe there. Give that a little wipe. Special wipes there. Okay, that's come up lovely. Wish my veins were this good. Okay, right, just going to feel a sharp scratch. Okay, I don't need to take too much, so just keep nice and still for me. Okay, alright, here we go. Sharp scratch. There, well done. Okay. There. Okay, just going to change that bottle. Perfect. Okay, relax now. All done. Right, just could I ask you to hold this swab over there for me? Thank you. Get this tourniquet off. Perfect. Okay, just hold that there a second. Okay, right. Pop that over there in the bag. Perfect. Get that sent off. Those results will be back within a day. No problem there. Okay. Alright. Well, I think you do have trigeminal neuralgia. I'm going to try and prescribe you some different medication if that's okay. There's no guarantees it will work so well. Are you allergic to any strong pain relievers? No, you're okay. I can attack this two ways. I can give you a stronger pain reliever, or I could try it by giving you a medication which helps numb neuropathic pain, but they don't always work that quickly. And actually what I'd like to do is send you for an MRI scan, so you can have this area scanned, and I can check for any blood vessels that may be pressing on that trigeminal nerve. Sometimes we can't find a cause, but sometimes it can be caused by a pressure onto the nerve. Okay? Is that all right? Okay. Would you like me to refer you through the normal system, or would you like to pay privately? Obviously, if you pay privately, you will get the scan quicker, usually within about a week. Otherwise, the wait could be a few weeks. Okay. All right, that's fine. I'll make a note to do that referral. Okay, so you want to try some stronger painkillers? Right, okay, I'll do that now for you. I'll get your prescription sent straight over to the pharmacy. Any problems, do call us if they upset you in any way. They will make you feel a little bit drowsy. Sometimes people might feel a little bit nauseous with them, but take them with food. Okay, but if you do need to drive, operate machinery, then it's not a good idea to take them, okay? Alright, that's all sorted there. Okay, so try not to lie on that side if you can help it, if that aggravates it. It does, yeah? Yeah. Okay, I know sleeping can be difficult when you're in so much pain because of these sharp jolts. Alright, but we'll get you scanned. I've had your bloods done there, so I'll let you know the results of those. Okay, I'll give you a call. Probably tomorrow now, yeah. Okay. Alright, my lovely, you take care, and I'll also call you when we get the results of your scan. Yeah. Okay then? Alright, take care. Bye-bye.